From the News Channel 5 Network, this is OpenLine.
Well, good evening and welcome into Open Line. I'm Chuck Long, going to be along with you for the next hour. Tonight on Open Line, it's Ask the Expert, and we're talking about your teeth this evening. We're asking the endodontist, and we always like it when Dr. Richard Horwat is here. He knows his stuff, and a lot of you always call him when we have our Ask the Expert, Ask the Endodontist. Going to be a great show. Going to get right into it. Dr. Richard Horwat from Bluegrass Endodontics. Great to see you, Dr. Horwat.
Nice to be here again.
And I tell you, like I said, our phones always get very, very busy because I think not only when it comes to, think endodontics, you think root canals and that sort of thing, but there's a number of other things, from saving a tooth to chipped teeth to infected tooth pulp. I mean, there's a lot of things that go along with what you do. And just the mouth in general and the questions that people have. So we always encourage you, when you do have a question, go ahead, give us a call as soon as possible at 737-7587 here on Open Line, and we'll get to as many of those calls as possible. Just kind of wanted to start off with endodontics. So for someone watching endodontics, kind of just give us a good overview of that.
Basically, an endodontist, what we do root canals. Anything from a patient being in pain and coming in and getting a root canal, or maybe a patient's had a root canal and it didn't really work out favorably for them, and we'll get in there and we'll actually retreat the root canal and do things of that aspect of them. A lot of times a general dentist will just sometimes they can't really figure out what's going on. A patient will come in pain. They know it's on the lower right side, and we'll come in and we'll kind of go through a bunch of clinical tests with them, take x-rays, and we'll try to isolate which tooth it is. Many times, the four teeth on the lowers on either side, they're sharing a nerve. So sometimes a patient will come in, they'll think it's one tooth, and when a general dentist can't figure out, they'll usually send it to us, and we'll do our testing, we'll go through it, and we'll figure it out, and we get them out of pain.
And that is generally how it happens. You go to your dentist, you have a problem, and the dentist then recommends that they go see you.
Sure.
Now, our line's already busy, so we're going to go to the lines right now. So line one, David is with us this evening. Good evening, David. Do you have a question or a comment for Dr. Horwat?
Yes, I got a question.
Okay, go ahead.
I go to the dental school and I get my teeth cleaned, and the past 6 months they use the air polish on my teeth, and after so many weeks I get stains back on my teeth, and I know I drink soda, but I don't get soda at the top of my mouth where my teeth get stained at, and I was wondering what's making my teeth stain so much. They said it could be medicine or something. I was wondering what I could use to take care of that, get rid of those stains on my teeth.
Okay, without taking a look at you, it's kind of hard to determine specifically what's causing it. But a lot of times, I'm not exactly sure of your age, but a lot of times when you get to a certain age, the deposits that's in your saliva kind of changes as well. And I don't know if this is going to be the answer we're looking for, but you get a buildup of something called calculus. And even in small degrees, when you get the calculus built up on the teeth, a lot of times that's pretty much what's staining. It's kind of, for lack of better ways of describing it, it's kind of like a very thin sandpaper. And so it's textured, and bacteria and stains don't have a problem really sticking to it, and that might be what you have going on with regard to that. But I'm not really sure. Things to do that are preventative, anything to get your salivary glands moving, salivary flow, chewing gum. Make sure you're using a sugarless chewing gum. That will probably help out to some degree. I encourage everybody to brush before they go to bed. Everybody should be brushing at least after every meal, technically, but I don't know too many people that do that. But I definitely would encourage you to make brushing before you go to bed, make that a religion, and that way, your salivary glands kind of slow down at night. That's why even when you brush your teeth at night, you wake up with bad breath. Your salivary glands aren't really flushing things down, and you just kind of, the bacteria builds up. So you should always brush before you go to bed, and of course in the morning, and you can do that. But going to the dental school, I think, for cleanings is a great idea, especially if you don't have insurances and things like that. They do a good job, and they can always, they always appreciate you guys coming in there so that they can practice.
Right.
And things like that.
All right. Well, David, thanks so much. We appreciate you calling in this.
Thank you.
Okay. Have a great evening.
You too. Bye-bye.
Thank you. All right. So always good to know too. And I think some people think, or at least ask, can you overbrush? Can you brush too many times during the day?
You know, that's a good question. I don't know if you can overbrush. I guess you probably can. You can overdo just about anything. I definitely would recommend only using a soft toothbrush. I know that they have those hard ones out there. I can't find much of a use for those. I think that they're really good for cleaning your cars and and getting into fine places and things like that. But they're a little bit too abrasive. I would only recommend using a soft toothbrush. And I think you can overbrush. I know that the over time, you know, your gums may recede a little bit, and some people kind of brush aggressively, and they get little wear facets in there. So you can have a toothbrush abrasion and things like that. I don't recommend just scrubbing it or being very aggressive with it. But you should only use a light toothbrush.
Okay, good to know. Back to the phone lines right now. Tori is on the line with us. Good evening, Tori. Do you have a question or a comment for Dr. Horwat?
Well, I have a couple of questions.
Sure.
One is, I was wondering why dentists don't make emergency room calls.
Okay, I don't have an answer for that one. I'm not really sure why they do. You know, a dentist will usually book their schedule up pretty well. How do I describe this? You know, I think of the airlines when I think about how people set up their appointments. I don't really know the true statistics. I haven't really checked them out myself. But even when I was a general dentist, studies have shown, and I'm not exactly, you know, proclaiming that this is accurate, but that 1/3 of your patients are going to no-show all the time. So the airlines know this as well, and that's why they overbook flights, is because they know that 1/3 of the people aren't going to show up and things like this. The dental offices, if you create those voids in your schedule to accommodate those emergencies coming in, they probably won't come in, and then you're sitting around twiddling your thumbs all day. You know, I think that generally when an emergency comes in, or if it is for the general dentist, a lot of times the general dentist isn't going to take care of an emergency anyway. I know that when I was a general dentist, when someone came in and there was something severe or major going on, I was always going to refer them out to the endodontist or the oral surgeon anyway. So a lot of times it's probably why they might not be doing that. I'm not really sure. But I'm sure that if you call their office and told them of your emergency, they would most certainly guide you in the right direction. To where you could go.
Okay. Tori, do you have another question? I think you mentioned you had a couple.
Yeah, I do.
Okay.
Another one is, I know a person that was in an accident and had a lot of problems with their teeth. And usually when those teeth go hurt, it's the middle of the night, and that's why I was wondering about the emergency room. But another thing is, I thought of the health department for him, but they only take 2 people a day, and the 2 people they have to call at 8 o'clock in the morning, and the rest they take is children. They take children all day, but children have TN care and can go to other places.
Yeah.
And I was wondering why, you know, they don't have a dentist and dentist and health departments that won't help adults.
You know, I don't know the answer to that. I know that our emergency system here in the United States and in every state is great. You know, you might, if there is an emergency, you can always go to the emergency line. There's usually a dentist at the hospitals, you know, to take care of emergency care. I did that myself for a little while in Pittsburgh. And someone will accommodate you, but the only problem with that is that with them providing that service, you're probably going to have to wait a little while, unfortunately. And you know, I don't have a really good answer for you on that one. But you know, if there is an emergency, you can always call 911. You can also go to the emergency room. Just know that you're going to probably wait for a little while.
Yeah. Okay.
Okay. Well, we appreciate you calling in.
Thank you.
All right. Thank you, Tori. All right, going right back to the phone lines. Tammy's on the line with us right now. Tammy, good evening. Do you have a question or a comment for Dr. Horwat?
Okay. Well, we appreciate you calling in. Thank you.
Tammy, I think you possibly are a little close to the television. I think we're getting feedback.
Yeah, question or a comment for Dr. Horwat?
Oh, I have a question.
Okay. All right, go ahead.
I'm sorry. I have a question for the dentist about I have a tooth that has broken off and the nerve is exposed. So how would you fix something like that?
It depends. You definitely want to go to the general dentist, and that way we can assess it. We can take x-rays. We can find out the extent of the fracture. With the nerve being exposed, teeth don't generally just break unless there's some type of trauma involved. And usually if they do break and there's trauma, there's probably some type of underlying cavity as well. So we need to determine the extent of the fracture first off and find out what your options are. And then we'll go over the risks, the alternatives, the benefits to different treatments, and then we can both come up with a game plan to find out what's best for you. But generally speaking, if you do have a fracture or you have some type of damage to the tooth or some insult to the tooth or injury, and there is a nerve exposure, you're more likely than not, assuming you want to keep this tooth, you're going to need to get this tooth root canaled. The nerve will die if it's not dead already, and your only other option, unfortunately, would be to remove that tooth. And of course, if you remove it, you have replacement options as well. So again, you're going to want to check with your general dentist so that we can come up with a treatment plan that will suit your needs.
Okay, well, Tammy, thanks so much. Hopefully that gives you some help.
So again, you're going to want to...
All right, well, have a great evening. What we're going to do right now, we're going to take a little break, and then we're going to come back. More questions with Dr. Horwat. Write them down. Give us a call, 737-7587, and we'll be right back with more Open Line right after this.